Information, they continue for the updates about the COVID-19 at the country. Well, say network then at the National Emergency Operations Center for get more updates as yesterday 6 people done well from the COVID-19. Now let me listen to the Deputy Minister of Information and Communication, Madam Amadi Gobe Kamara, as he give the update, and also to Mr. Harold Thomas, where he said they tell me more about waiting people left for do concerning the face masks.
Press briefing. The Honorable Minister of Information will give the press statement.
Good morning, everybody. So for status update for COVID-19 today, Monday, 20th April 2020, Sierra Leone has recorded 8 new cases, bringing the total number of positive confirmed cases of COVID-19 to 43. 6 COVID-19 patients were discharged yesterday to go home after meeting the criteria of testing negative to the 2 tests conducted 24 hours apart. There is no death reported. The 37 COVID-19 confirmed cases currently under observation are being managed in isolation centers. All are in a stable condition. The total number of persons quarantined is 567 and 1,050 have been discharged from quarantine. Members of the public are encouraged to call 117 if you have fever, tiredness, and cough. Members of the public, including transport operators, motor drivers, keke and Okada riders, are strongly advised to always wear cloth face masks in all public spaces, including government offices, hospitals, and marketplaces. The use of cloth face masks together with other preventive action can help reduce the spread of COVID-19. Government of Sierra Leone would like to commend those individuals and organizations that have been providing cloth face masks free of charge to members of the public and would like to encourage others to do likewise. Enforcement mechanisms will soon be put in place, so everyone is advised to make an effort to secure a cloth face mask. The public is further encouraged to continue to frequently wash their hands with soap and water or use hand sanitizer, avoid touching one's eyes, nose and mouth with unwashed hands, cough or sneeze into their upper arm or sleeve, and avoid close contacts from others, especially in crowded areas. The public is encouraged to take good care of their health to help protect against COVID-19. Take children for marklets and go to the hospital for antenatal care, safe delivery, malaria testing and treatment, and other regular care. Hospitals remain the safest places to go for health checks, treatment, and care. For more information, visit our websites www.mic.gov.sl or www.dhse.gov.sl or call the following numbers: 117 or 099 058855, 088421575 or 088421288. Thank you very much.
Hello, welcome to this interview. Your name and that you do.
My name is Amadi Gobe Kamara. I'm the Deputy Minister for Information. We don't get positive confirmed cases. We in the hospital. We get case 1, we don't get case 2, and there was a lot of contact tracing, surveillance done by different people. The way we don't make the cases, they don't go at a certain number. So we've been getting cases and they'll be admitted. They've been in isolation centers, in 34 and other places where they monitor them as they go along. So then particular 6 people there so now, and don't go through the various steps. And yesterday they discharge them because they do like a test again for confirm whether they're negative. So they don't do the 2 tests on their individual there. So there's 6 individual there. So and they don't discharge them, say they're okay to go home. But of course monitoring of them people there will still continue.
Okay, as according to the press statement where the updates we can always get, governments they advise the public for use facial masks, and also we see also plenty message go on social media. We say not to everybody for use facial masks. Then why the government they tell people, they encourage people for the use facial masks, especially when they're in the public area?
Yes. First of all, so I want to speak quickly to this issue. We talk about social media. Again, not to social. They compare with social media they say and government, because government always they lead in terms of bringing out the information which could be helpful to people then. And social media, most of the time, are people the way they try for disrupt, the messages that we government put out there, and some of them now they for try for bring confusion in the minds of people, and that some of them messages are going on social media. So again, I don't want to make you compare, say, government, say, social media, say, because social media, most of what's in the happen there right now, nothing that we just say continue for pose challenge to the effort of government in terms of putting out the right messages into people, and as far as for curtail the spread of COVID concern. Now back to the issue of facial mask. Now in other places, there are some schools of thought that in Asian countries, for example, people then believe, say, where people are not they use masks, facial mask, and that makes so the spread of COVID at their side, and they really don't go out of hands like in other places there. So facial mask has been identified because remember with COVID, every day new things and they come up. When we start, there were information about washing of hands, we're still obtained. There are information of using of hand sanitizers, maintaining social distance. So in addition to the messages and now, there are suggestions, that use of facial mask they help for control, for curtail the spread of the disease. So like you get facial mask now, if you sneeze or you cough, that droplets where they can say can come out of person mouth. If you touch other person, when the thing the way they try for make people understand, say this virus is being transmitted through droplets. So if you cough now, for example, we get facial mask, they come to the next person waiting back near you. So it has been established as facial mask. Now one of the methods, one of the measures that people can adhere to for help for spread, for help for curtail the spread of the virus. So we encourage people as government for make sure say we adhere to this wire. So of course you get a lot of people the way they tell you say, oh, it's uncomfortable, it make you feel bad and all that kind of thing. But this is about you, the protection of your family members, the protection of your loved ones. So now we could encourage people them as much as they're uncomfortable. Again, in addition to that, they would always tell people and say, if you're not getting nothing for candle, not skit. If you don't get nothing for common use for candle, it's advisable for stay and use. But if you therefore come out to go in a public place, obviously we'd encourage you for make sure so you put on your face mask. And as a result, we get people that we don't come out, we get organizations that we don't come up, we don't give donation of masks to different people because some people then say, oh, the mask, we're not able to afford it, we're not able to buy it. So we get people that we don't come out and we they provide masks for people then. And we continue to encourage people and say, if you're out there and you get the wherewithal, you get the capacity for able to provide masks, that is not a bad idea also for yourself join in for support government, for make sure say the mask reach out to as many people as possible.
Okay, and also we see the marketplaces them so crowded. What in the government they do towards them places then they?
Well, again, we continue to encourage people and for stay away from them crowded areas and they. But of course, I'm sure you are aware, say the mayor of the city and also the Ministry of Local Government, then they in some sort of engagement for make sure say we get different days there for let people then go there in a market so that we're able for decongest the market. So then kind of discussions and they will not hold. Now we need for just make sure say some of the things they would all agree on, we begin for implementing so that at the end of the day, the markets then will be decongested and people the way they sell in the market, they say get life. They're supposed to understand, say, this thing is about me and my family. So if government say now they're in a crowded place, I think to say it is what right in your own best interest for make yourself adhere to the measures in it. Because again, now you're alive, now you go sell and make money. You understand? Now you well, now you go even make money, now you go sell in the market. So we just continue to encourage them and make sure say let them adhere to what government don't say, stay away from crowded places. But of course, in terms of what government and do for make sure say then decongest the market, measures are being put in place, and very soon we will begin to see that they come into effect.
Okay, before we end the interview, what's another word of encouragement where you go and get out there to the one that we just don't come out from the COVID-19 center concerning the community, because plenty of people go look at them right now, say they're not for go close to them.
Well, we want for really congratulate them one day because a good number of them do the right thing, like for example, the first case, na Inco, na hospital by himself, and a good number of them also. So let we continue for support them with prayers and with support to them, now make them able to beat the virus. So let we just continue for encourage them because again, this is not sickness, nobody pray for sick, but them sick and thank God they don't recover. So the families, the community for continue for embrace them and continue for applaud them for them good effort, for the good step where they take, then they like today they're not free. So what me they say to you, if person they out there and you sabi somebody where don't they show signs of COVID, or you they feel say oh this is a fambulan or important or anything, you know they help the situation. Bring her out because you don't see say people they actually they recover. Thankfully, nobody not don't die as a result of COVID alone. And if you come out quick and get the help you need quickly, you will be safe, and the family members and the rest of your loved ones they also will be safe.
Okay, thank you very much.
Thank you very much.
Hello, welcome to this interview. Your name?
Harold Thomas, Health Education Program Manager and Lead for Communication at the Ministry of Health and Sanitation.
Okay, we see yesterday with 6 people don't come out from the COVID-19 center. I go have to make it tell we waiting this mean to salon.
This is a clear testimony for say not to everybody we get COVID-19 go die. The case fatality rate for COVID-19, meaning the one that we get and the one that really die, is very, very low. So this they encourage people with positive way, then they take them for going to treatment center for no say very, very high hope they for that person they will recover.
And also the government they always advise people for use facial masks, especially when you're doing at the public side. And we know so plenty of people don't know how to use the facial masks, but why the government they continue for encourage people for use facial masks?
We encourage people for use facial mask or face mask, especially cloth face mask or locally made face mask for the community people because we don't know say using face mask in addition to other precautionary measures they help for reduce or slow the spread of COVID-19. So now that make especially in public spaces where people in a market, na supermarket, na shop, any side when a crowded area or even motorcar or if where them plenty inside it, or then transport or Okada, we then suppose for use face mask. Because if you use face mask effectively with other measures, then we reduce the spread, and at this we try for push.
So how many hours you for put on the face mask? How many hours?
It depends on how long you in a public space. That make if you know say you're not able to use mask, if you then you host, it's fine as long as you practice safe distance that you host. So if you're not able to put on face mask, fine, but not go to public. If you want go buy something, send somebody where they use face mask because we don't want to expose anybody at this time.
So this confirmed cases they also will be get today. I go want to know if now within the city number we get it.
Now we get a number of patients. By yesterday we will be pulled this them people here na 35 been there na the treatment facility. So 6 out of them 35 then they nine be being free of the virus. So then 6 then they then do tests, 2 tests with negative, we then do 24 hours apart. According to WHO criteria, when somebody don't free or where in order to get them signs and symptoms, the doctor then do assess it. This don't look like say well. The only way we then go pull and do now for me then do 2 negative tests 24 hours apart, and then do that day and then find out say them patients and they been free. Now make then discharge them from the facility.
So what's the message we go and send out there to the general public, especially people where they fear right now for go with them picking and for go take maculates?
Oh, we always done the push this message, and I will still tell people and say, before Corona come, we be done they give maculates, we done they do other things them. People and be done they sick, but the woman and be done they go to hospital, and the hospital and where then they go, you know, na hospital them where they not they treat Corona patients and they. So we they advise that people and care them picking and go for maculates, but the woman and go born and then go for the antenatal clinic. And if you sick, you get malaria or any other sick, go na hospital. Hospital na the safest place where you for go when you sick. Because we all don't see say Corona patients then they survive now. So if you afraid Corona, you're not going to hospital. Then other disease then they make you sick, bad one, and you die, you not go fine. So we for much as we prevent yourself from Corona, we not for dinner or sick, we not for kill we, sick we not for make we we sick seriously, we get them.
Okay. Thank you very much.
Welcome.